Today's topic is all about sexual problems. Sexual problems can be classified into physiological, psychological, and social in origin. Physiological problems are the least among the three categories. Small number of people suffering from diseases due to abnormal development of the genitalia or that part of the neurophysiology controlling sexual response. Example, vaginal infection, retroverted uteri, prostatitis, or the inflammation of the prostate gland. And then adrenal tumors, diabetes, senile changes of the vagina, and cardiovascular problems. Now for the medication through surgery. Psychological problems usually caused by socially induced inhibitions, maladaptive attitudes, ignorance, and sexual myth held by society. Example is mature sex must involve rapid erection, prolonged coitus, and simultaneous orgasm. So the methods used for this one are magazines, married books, and general sexual folklore, which often strengthen these demanding ideals, which are not always achieved, therefore can give rise to feeling of inadequacy, anxiety, and guilt. Hence, resulting negative emotions can definitely affect the behavior of an individual. Now let's proceed to the common sexual problem for young male. The first one is premature emission of semen, and which is most common for young males. It is because of the natural result of excessive tension in a male who has been sexually deprived. Next is erectile impotence, and is almost always a psychological problem in males under 40 years old. In other cases, the impotence may be the result of disinterest in the sexual partner, fatigue, and distraction because of non-sexual worries, intoxication, and other causes such as occasional impotency, and is common and requires no therapy. The third one is ejaculatory impotence, or the inability to ejaculate in coitus, is uncommon and usually of psychogenic origin. It is due to the past traumatic experiences. And occasional ejaculatory inability can be possibly expected in older men or in any male who has exceeding his sexual capacity. And for the female, the common sexual problem is the vaginismus, or a strong spasm or contraction of the pelvic muscle constricting the female reproductive organ so that penetration is painful or impossible. It can be due to anti-sexual conditioning or psychological trauma as an unconscious defense against coitus. Now, what are the medications for these sexual problems? The first one is psychotherapy, and by gradually dilating or widening the female organ with increasing large cylinders. So this ends the topic. So for summary, we tackle about classification of sexual problems, the medication through surgery, common sexual problem for young male, and then common sexual problem for female, and then the medication.